And welcome everybody to the Greater New Haven Chamber of Commerce, our Small Business Council, as we discussed interesting and pertinent topics to your small business. I'm Ray Andrusa. I'm the Executive Director of the Quinnipiac Chamber of Commerce with the affiliate chamber of the Greater New Haven Chamber of Commerce. In these monthly webinars, we address specific topics related to your business, bring you helpful information that you can use. And this is a resource. It is a webinar. You can come back and get our information and speak with our guests and our contacts that we bring to you during this program. We'll be talking with Steve Glick from the Chamber Insurance Trust. Will be one of our guests will be joining us. Also, Ina Kuricek from TASC, Regional Sales Director, will be joining us. We thank you both for being with us today. Right now, I'd like to bring in our President and CEO of the Greater New Haven Chamber of Commerce and the Quinnipiac Chamber of Commerce, Garrett Sheehan, for some welcoming remarks. Garrett.
Great. Thanks, Ray. Really excited to have everyone on here, especially Chamber Insurance Trust and Steve and all of the team that he's pulled together for this event. Insurance continues to be one of those major cost drivers for so many of our small businesses, large businesses as well. And I know Steve has a great product he wants to talk to us about, but just also talk about some of the challenges that businesses face in finding the right price for insurance. So I think it's going to be a very informative program. And again, appreciate Chamber Insurance Trust supporting the chambers as they always do, but offering this program as well. Thanks, Ray.
Thank you, Garrett. Now we're going to welcome your questions and we're going to welcome your comments in the Q&A. We'll be taking your questions a little later on, and also we welcome comments in the chat where we can follow along as we go on through this program too. We also from TASC would like to welcome Michael Leffler, who's joined us. Michael, it's good to see you here for our webinar today. So here we go. This is important, healthcare. And as some of you have been paying attention to the rising cost of healthcare for your small business, there's been a wide range of occurrences in terms of costs to your business. We're going to hope to explore and identify some of the issues that you've been facing in this webinar today. I'd also like to introduce one of our guests who's joining us now here too, Steve Riggs. Steve, we thank you so much and tell us a little bit too about things later on as we develop this conversation going forward later on. We welcome Steve Riggs with us here today too, and also from National Health and Wellness. Thanks for being with us here as part of our Small Business Council webinar here today with the Greater New Haven Chamber of Commerce, Quinnipiac Chamber. So Steve Glick, we're going to turn it over to you. You have a lot to tell us here today. You have a lot of information. Tell us a little bit about the state of healthcare, what's going on right now, and some of the products that you're going to discuss here today.
Well, I welcome everyone to this seminar, and I hopefully will bring some ideas and hopefully change the course of action for many of you out there. It's been almost 35 years that I've been involved with the Greater New Haven Chamber. In fact, the whole institution that I built up emanated from working with the New Haven Chamber, just as an idea to know that things can happen when you participate with your community and participate well. What I like to do first is to go a little history of what is happening in healthcare, and then I will allow some of our speakers to share some thoughts. Then I want to come back with some solutions for you to consider in the overall fact of healthcare increases. The issue right now is we are in a serious problem. Rates of healthcare have exceeded more than ever the cost of earnings and capacity to afford healthcare. And I'd like to go over a little history with you of what has happened overall, especially over the last 20 years. You know, if you go back 20 years, would you ever thinking that a health plan would have a $6,000 plus deductible as a starting point for your needs and directions? Just less than 6 years ago, you would not see that. The other side of it is the rising cost of healthcare. And for many people, by the way, the history is less than 22% of the people that have healthcare are actually using it. So there is a major void in there, and we're fighting unaffordable coverage prices. And we're going to talk about that. But we're pleased to announce the formation of a new type of program that will lower the costs and improve the well-being of its members. As carriers are announcing double-digit increases in costs and reducing benefits, we call our new concept called the Unified Healthcare Program has now positioned itself as a cost-effective solution with multiple program choices that the consumer needs to maintain quality care. What I'm really going to be talking about is a re-education and a new thought process to use when considering buying healthcare. The Unified Healthcare Program is a combination of benefits that work together. That's why you're hearing different company names and directions for healthcare. My favorite customer is in my back room right now, so you can hear him. The benefits work together that can provide lower costs and out-of-pocket exposure than ever before. The problem is people don't understand certain types of programs. Have you ever heard of the word HRA, Health Reimbursement Arrangement? Well, you will hear about it in our discussions today. Unified Health Program is working with leaders in healthcare industry that have proven success with each of their separate plans. And so we're going to begin the talk about this. But the idea here is you're going to see that if you take certain programs that have been in existence and tie them together and bring it into a unified format, we now have a competitive issue to consider or benefit to you as a consumer with a small company or large company. We've got to get away from these large deductibles and yearly increases. So I'm going to begin the discussion with our guests, Ina and Michael, to share a company that is well recognized in the industry across the country that is participating in our program. The company is called TASK, which is a program that deals with health reimbursement arrangements. So I'm going to give them the floor for 5 or 10 minutes just to give you that opportunity to hear about what is there that you may have never been aware of.
Well, thank you,
Ina?
Steve. Thank you very much for that. Thank you for having me here today. As mentioned, my name is Ina. I am the regional sales director for the greater New York City area, as well as the Connecticut market. My primary mission day to day is to help entities like the Chamber of Commerce and a lot of the benefit brokers and that respective community secure very cool and creative benefit programs for their clients to help them attract and retain key talent. TASK has been in the business for 45-ish years. So we're not the new kid on the block. We've been around for quite some time. And it's important that we anchor to our mission, right? Our mission is to improve the health, wealth, and well-being of our clients, their employees, and the communities they live in. And essentially that ties very well with the whole HRA concept due to the fact that we're going to encourage a benefit program to help with the health. We're going to try to keep it as competitive, cost conscious as possible to focus on the wealth. TASK is also very philanthropic too. And that's the giving part to the communities. And that's certainly something we could talk about in the future. But like I mentioned, TASK has been around for 45 years. We do a lot in the HRA space. We administer benefit accounts such as FSA, HRA, HSA, parking, transit. So think in terms of money movement. Any type of account that moves money, we can administer here at TASK. We understand, we know compliance, such as ERISA, FMLA, ACA, continuation, which is our term for COBRA services for any groups over 20. So when a regulation changes, it's our job at TASK to respond and remove that complexity for you. We want benefits to feel like benefits. So when Americans have more money, they invest in their health, their families, and their communities. I think everybody wins at this point. But today I'll focus mainly on HRA. I will provide a quick overview of what an HRA is, the common types of HRAs, and how they're administered and why the HRAs are beneficial. So an HRA stands for a health reimbursement arrangement. An HRA at its core is a tax code, right? It's a self-funded health plan governed by Section 105 of the tax code, and that's typically aligned next to an underlying health plan. HRAs may be designed in many fashions to suit specific needs of your employees. It's one of the most flexible types of employee benefit plans, making it very attractive to many employers. An HRA is IRS sanctioned, employer funded health benefit plan that reimburses employees for eligible out-of-pocket medical expenses. So an employer contributes a set amount of money for each enrolled employee, and then the employee can use that money to pay for eligible medical expenses. So neither the employer or the employee are taxed on this money. So it's double savings. All eligible expenses are listed under the IRS code section 213D. It could be covered by an HRA at the employer's discretion, of course. An employer can choose to offer their employees coverage for only one type of expense, all expenses, or any combination in between. Reimbursements of an expense through the task HRA does require substantiation. And what that is a document that provides the expense, it proves that the expense is eligible under the HRA plan rules. And only eligible expenses with dates of service that fall within the HRA plan year can be reimbursed. So what I mean by that is when an employee incurs a medical service under their insurance plan, they'll receive some form of documentation, right? So typically an EOB or explanation of benefits letter from the insurance carrier would be preferred. It is the preferred document in many cases. So after the plan year ends, employees normally have a period of time in which they can submit claims for the closed plan year. This is called the runout period. So 90 days is the standard runout period, but employers can choose any length of time. A carryover or a rollover allows any unused funds from a closed plan year to be rolled over to the new plan year. And again, an employer can choose whether or not to allow rollovers in their task HRA plan. And again, employers have full discretion over how the carryout is managed. They may choose to allow the employee to keep all or only a portion of unused funds for use in later years, or may require forfeiture of all fund balances after the close of the plan year. So again, HRAs are very flexible. They allow the employer to design their plan to meet the unique needs of their company and their employees. Some of the common plan designs include deductibles, copay, co-insurance, prescription costs, no premiums, but really any of those times that you're reaching into your pocket and paying for that out-of-pocket cost. And again, most importantly, all employer contributions to the plan are 100% deductible to the employer. 100% tax deductible to the employer and tax-free to the employee. So I know that's a lot to take in all at once, but that is a high-level overview of an HRA. So thank you very much.
It's great. And we want to welcome Michael as well and your role too, and what you've been doing. That's a wonderful presentation. Thank you, Annette. So, and thank you for the Golden Gate Bridge too. That's a nice backdrop. So Michael, tell us a little bit about your role and embellish a little bit of Ina's comments.
Sure. So Ina and I both actually have the same role, but different territories. So I cover all of the upstate New York area. So I'm Buffalo to Plattsburgh and down to the city, but Ina covers the city and then covers Connecticut. So we do cover the same role. I'll just put a couple of comments to add on to what Ina said that I think is a really good way to look at an HRA. But an HRA is a promise from an employer. It's a promise to pay certain expenses. So an employer decides how much they're willing to contribute. That money's not actually contributed until it's spent. So the nice thing here is, and what Steve is putting together with a MEC plan and having a wellness program, is if the employees don't spend the funds, the employer hasn't spent the funds. So the employer makes a promise to pay up to a certain amount for certain things. And then employees have different ways of using those funds when the other health plan options are unable to pay the cost. So the intent here is to, an employer can promise to pay, let's say, $10,000 a year in an HRA for employees' medical expenses, but your average employee might only spend $2,000 of that, meaning the employer doesn't realize that full cost, as opposed to a premium, which is a guaranteed loss, because premiums are out the door as soon as you pay those premiums. You're not going to get those back.
That's great. That's a lot of information. I think it's important that that we highlight that, and thank you for your contribution too. So what I think we'll do, just to set the ground rules so everybody knows how we're doing this in this webinar right now, is Steve has introduced our program, and we've had this wonderful conversation too about Task Within It. Michael, we'll bring in Steve Riggs in just a moment too, and Steve will tell us a little bit about National Health and Wellness. But we're going to welcome your questions in our Q&A there, or you can send something in the chat if you wish. And we're going to share at the back end of our program some of the questions. So we'll just keep our programming and our presentation moving along. Also, we'd like to let you know that we will be adding two people coming here. Tim Verone has just joined us. Tim's going to be joining us after Steve gives his presentation. Tim is with Options Plus. So Tim, thanks for joining us. And hang on, after we get through Steve, we're going to be coming right over to you. But right now, we'd like to go over to Steve as part of his presentation too with National Health and Wellness. Steve, tell us what's going on.
Thank you very much. Thank you for attending, everybody. Appreciate your time. So my name is Steve Riggs, National Sales Director for National Health and Wellness. And what we're really doing with Steve Glick and in the state of Connecticut and throughout New England and the country is we're really asking people to take a new look. One of my favorite questions when I talk to businesses or I talk to brokers is paying too much for health insurance? And the answer is always yes. And their answer is yes, or, a whole line of slews about health insurance, right? That's what we're really trying to change here, the way health insurance is looked at, the cost of health insurance. So when I say, are you paying too much for health insurance? And they say yes, my answer is always, are you ready to try something new? Right. And that is what the Unified Health Plan is all about. It's all about trying something new to help businesses, save on those expenses, to help those employees, really financially protect themselves. When I talk to brokers or broker agencies or, independent agents, which I'm sure the chamber has a lot of, the question is the same, just a little different. Are your clients paying too much for health insurance? And the answer is always yes. And then it comes back to, are you ready to try something new? So for those agencies and independent agents, I'd say, hey, reach out to us, reach out to Steve Glick. We have a new solution for you to help your businesses, your clients. For business owners of the chamber, reach out to us. We have a new solution for you to save money and to bolster your employee benefits package. But getting back to specifically what my piece of Unified Health Plan is with National Health and Wellness is we're bringing in an incentivized wellness program, right? Many people have heard about wellness programs, but they really haven't heard about the incentivized wellness programs. As Ina mentioned before, she mentioned 105 and Section 213, right? IRS codes. It's all about IRS codes. And that's how the government is helping us create these savings for employers and employees. And we're really making a big impact. So what is incentivized wellness? It's a combination of two things. It's a robust wellness platform that people can individuals can go ahead and log on to their own personal portal. And then it's an earned credit. Employees will earn credits, a monthly credit, for engaging in qualified wellness programs. I already heard somebody in the background. They're very excited about that. Was that on your end, Steve? See, we're exciting people across the country here. But the most important things regarding a wellness program is for businesses, there's no out-of-pocket expenses. We do not need to change anything that you currently have in place. You're talking about huge savings for employers. Roughly on average, for an employer that implements the wellness program, they're going to see about $500 annually in savings per participating employee. Okay, that can add up very quickly depending on what company you're talking to. You know, a company of 10 can save 5 in a perfect world. A company of 100 or 200 can save substantially more. So what can they do with that money that they're saving? Well, they can reinvest it back into the business. They can reinvest it back into their health insurance plan and really help offset those costs, right? Now, most importantly, Ina touched on it, attraction and retention of employees. It's not about the dollar bill anymore. It's about the benefits that people are receiving. Employees are stressed, and they are stressed to the max in terms of financial. The majority of individuals are living paycheck to paycheck nowadays, right? What happens when they gotta go to the doctor and have that $5,000 deductible, right? They gotta come up with that up front. The majority of Americans do not have that money, right? So what do? They delay treatment. And what does delaying treatment do? They take a small issue and make it into a major issue. And that's really what we're trying to combat here. We're trying to get the cost of healthcare to come down. How do we do that? By making people healthier, by making people the CEOs of their own body, right? It's very important. So through the wellness program, people can go ahead and they engage in the wellness program, and by engaging, they're going to receive a credit. That credit nationally is $150 per month that an employee will see. That they can spend on supplemental insurance policies, going with that 213D compliant policies, right? So we're talking about accident plans. We're talking about life insurance plans that build a cash value. We're talking about critical illness. If somebody gets a heart attack or a stroke or God forbid, cancer, right? These policies help fill the gaps that health insurance has, because we know more and more the individuals are responsible for more and more of the bills. So these bills help offset that cost. But one of the biggest policies that we're selling right now is the GAP plan. The GAP plan eliminates the health insurance deductible, right? And that can be paid for through their earned credits, right? So big difference. There's a lot of companies out there that don't have supplemental insurance in place. There are a lot of companies that do. The one thing that they have in common, the ones that do, is they are paying out of pocket. So those individuals are taking, you know, 20, 50 or more dollars a week or per month, you know, $100, $200 a month, and spending their own money because they know the value that these policies have. Well, what we're doing is we're offering them a way to go ahead and get those policies without spending a dime out of pocket. No out-of-pocket expenses for the employee on this. So they're getting the same coverages if they already have it without spending any money. So that money's going back in their paycheck. Well, that employer just gave that person a raise, right? How important is that when you're talking about retaining people? We know that retaining people and attracting people are very important to businesses nowadays. There is a labor shortage out there. And anytime you have a new employee come into your business, you spend time and you spend money training this person. And the worst thing that can happen for a business owner is to have that person leave with their newfound skill after 6 months and go to somebody else because they have a better benefits package, right? So that's really what we're trying to do with the wellness program. You know, it's amazing. It's amazing what we can do for an individual. For the business, we're saving them money. For the employee, we're protecting their financial security, right? Very important. And for the business, it's really about, hey, what can I do for my employees? Every employer out there, every employer in the chamber, I'm sure you hear it. I would love to do more for my employees, but I just can't afford it. There's nothing in the budget. Well, we're able to go ahead and help them enhance their benefits package without affecting their budget. It's win-win. So, a little bit, what are the benefits of bringing in the program besides the financial security that it creates for the employee and the tax savings that it creates for the employer while attracting and retaining, their top talent? The benefit of bringing in a wellness program is it improves employee health. Now, depending on the industry, if you have somebody that calls in sick because they're not feeling well or whatever, or they're an unhealthy individual, well, now you got to find somebody to cover that shift. Or you got, all of a sudden other people are picking up that load of that missing employee. The wellness program increases production, employee engagement with the company. Never underestimate the power that a great benefits program has on employees. Employees will stick with a company because of the benefits that they're getting. They're not going to be bouncing around. So that's important for your chamber members, right? And for the brokers and the independent agents that are out there, and I know this is being recorded and I'm sure it will be watched many, many times. Feel free to reach out to us. We're here to help. We want to help business owners. We want to help the agents, the agencies in the chamber. We want to help them help their employees, help their clients, and realistically make it where health insurance isn't a dirty word anymore, right? So with that, that's kind of what we do. We're here to help the businesses and their employees. And we're happy to be part of the unified plan with Steve Glick and offering this to the chambers.
Great. Thank you. That was a great presentation. Thank you, Steve. National Health and Wellness too. And we are going to welcome your questions here in the Q&A. If anybody has a question at this point, we'd love to have you drop that question in there. We'll be identifying these questions, talking a little bit more specifics at the back end of our conversation here in our program today. I'd also like to bring in our final presenter before we get back to Steve Glick, and we have our roundtable, is Tim Barone. Tim is with Options Plus. And Tim, welcome, and tell us a little bit about what you do.
Great. Thanks, Ray. Thanks everyone for hopping on the call. The nice thing you'll see about this is that the product we offer is a very simple product. What we offer is we offer a MEC plan. MEC plans are minimum essential coverage, and they serve two purposes for you. The first purpose is they give you access to daily utilization, going to doctors, urgent care, lab, x-rays, and I'll share my screen shortly to show you what the rates are and the plans are, because it's consistent. It's very predictable. The other piece that we do is that we solve a lot of the IRS issues for people as well. So one thing that we offer with a MEC plan is we issue 1095s. That 1095 is what shows that you offer group coverage. So that's another piece of the component too, is that if you need to offer coverage, validate the coverage is there, we offer the 1095 forms as well. So I'm going to share my screen real quick and walk you through what the plans are. They're very simple, very easy to understand. I'm going to focus mostly on that ultimate MEC because that really fits into the suite of what we're going to try to do. Shockingly, those are monthly premiums, right? If you're used to your normal premiums out there in the marketplace, you're looking at $400, $500, $600. Those are my monthly premiums. What these plans do is they give you access to the national PHCS network. So it's a national network of over 700,000 providers. And the goal of this plan is really to offer your daily utilization. So Steve and everyone on the team has talked about how they handle your hospitalizations and your major expenses. But how do you handle the day-to-day care, going to the doctor, urgent care labs, and things like that? And that's what we solve for you. So the ultimate MEC and any of the plans you see on the screen, there's no deductible, right? That's a very uncommon term now in the insurance industry. There's no deductible on these plans. All your wellness and preventative services are covered for free. Going to the doctor, going for your physical, annual OBGYN, pap smear, immunizations, all those are covered at no cost for the ACA mandates. We also give access to doctors. So going to a doctor, your primary or specialist, there's no gatekeeper, meaning there's no referrals needed. There's no primary care physician designation. So you can go to the doctors within the network as you see fit. It's a $15 copayment. I'm sure when's the last time you had a health plan that had a $15 copayment for your specialist? It was probably, when I was still in college or, which is a pretty long time ago, right? Is that where, these plans are really kind of giving you access to care at a low cost. Urgent care, lab and x-rays, all covered at $50 copayments. So this will give you access to all the daily care that you need to make sure that members can stay healthy and steer them away from the high cost of the hospital, right? Hospitals are really the most expensive place on earth for you to get services done. So within our plans, go to an urgent care, go to a lab, go to an x-ray, all the $50 copayment. We also cover medications. So medications are covered, generic and brand drugs, between a $10 and $75 copayment. You can offer any combination of these plans. If you like the Ultra Mech for some and the Ultimate for other, you could. We also offer a lot of virtual benefits, and I think the virtual benefits are growing more and more commonplace in the market. So we have telemedicine that's covered for free, unlimited. So you can go to a telemedicine provider at no cost and do it as much as you need to. Great way to triage things before you go on that long trip to the hospital or the urgent care. You know what it is. My kid gets allergies every year. I just need the medication. I need it all. I need to get a prescription. Great solution for that. And I think the other piece that we're adding, which is really more exploding in the market, is behavioral health. Behavioral health is the most common thing for people to look at now in insurance, is that, do we have something for mental health? We do a virtual benefit where you can talk to a doctor via your smartphone or a call like this, where you can talk to a therapist for a $50 copayment 3 times a year. Think of it as a way to people to get introduced to therapy. They've never had therapy before. They don't want to ask their friend, their family about how to access therapy or who their therapist is. They can do a soft launch by using it on the virtual benefit. If they love it virtually, they continue after that 3rd visit at $85 a visit, or they can get referred to a local therapist in their area. So really what the goal of the plan at the base level is give you access to that daily care. On top of that, we add in our companion card. The companion card is a really strong discount plan. So dental care, vision care, there's a lot of things that people like to buy. We include these products in this plan for free. So still under $140 and these plans are included. The dental, they can use any Dentamax provider in the country. They're going to get the fee schedule of Dentamax. If you've ever bought a DHMO for your groups, or have you ever been in one of those, they can cost a couple bucks. This is almost a free DHMO on the Dentamax network. For vision, they can go to Outlook Vision network, and they contract all the major chains. So get your routine vision at a fraction of the cost without having to buy the plan. Discounts on high cost medications. So the medications are really getting into a big issue in the country, especially diabetic supplies. They've done some good work with insulin recently, but some diabetic supplies can be thousands of dollars a month, more expensive than our formulary can afford. But we give you access to these types of benefits at a low cost. My stepfather, he's in Rockland, Maine. He's 88 years old, and he takes the Omnipod. It's the thing that you scan on your arm to make sure that your glucose and your sugar is okay. It costs $988 a month. It is, legal theft in that, for that price point. I was able to get it for him in Rockland at $88. So there's ways to work around to utilize the services and tools you have without paying high costs and high premiums. And the nice thing about the companion card is for members and their families. So if one of your employees signs up, but their spouse, their mother, their grandparent maybe needs a hearing aid, we can give them a 70% discount on hearing aids. And I think the other component that's really important in this space is a hospital bill negotiation. So as the members are enrolled in our MEC plans, they get access to our hospital negotiation team. So we talked about a lot of ways that we're going to pay for hospital and coverages through HRAs and wellness plans and voluntary benefits. But how do we get that bill to a lower point where these services can be covered at the lowest possible cost? And that's what our team will do. So they can actually use our hospital team. They'll upload their bills. We'll negotiate directly with the facility on the member's behalf to reduce a lot of the real issues in the health insurance market: duplicate billing, upcharging, all these dirty practices that keep the marble clean in the hospitals, but keep the patient paying the bill. And that's really one of those things we'll do, is really let you unbundle a lot of these services and get access to some high quality care at very low costs.
That's great.
Perfect. Really good. A good presentation. Thank you so much. And learned a lot there, Tim, as well. So this is a time where we're going to sort of put it all together. Steve Lick is going to explain what Unified Healthcare Program really is, how we get everything together that we've heard from our presenters here today. We are starting to get questions in the Q&A slot. We invite you to put your questions there. We're going to share your questions after Steve's comments here. He's going to put the whole package together. So Steve, why don't you tell us a little bit about the Unified Healthcare Program and the components that Ina, Michael, Steve, and Tim have presented here today.
Well, first, I want to thank my associates in helping explain this, but in reality, we have a problem over the last 10 years especially, is the lack of education on healthcare and the utilization and how to make things work. We're bringing that back. We're trying to help you guys make insurance affordable again and protect your families. I'm going to give you a quick example of a real company with 4 employees and what has happened by making the change to our unified program. Right now, the premium, and we looked at today the most current rates of 5 of the major carriers in the state of Connecticut that average over, in this case, $6,000 to $7,000 per carrier, very close to each other in that. But each one, to get this number, had to have the employees face a $6,000 deductible. And the employees have to pay 40, 50% of the cost of their own employee cost, and many have to pay extra dollars for dependents. So the overall cost of these insurance in the year for a 4-person company, looking at major carriers in the state, is $71,737. A big nut for a small company to deal with and to satisfy their employee needs. Now, taking the suggestions of integration of our programs, putting this all together, we have reduced the average premium. Some of the premiums per month with these carriers would be $6,500 a month, $5,700 a month, and way above the budget. Based on our changes, putting the MEC into place, put the HRA into place, putting wellness into place, we reduced that cost down to $1,049 a month. What a difference in cost and savings with better benefits, because a lot of the employees are not going to be faced with a major $6,000 deductible, and they're going to have more co-payments than out-of-pocket exposure. So in a nutshell, we are making insurance affordable again. I don't want to knock any of the major carriers. They're doing a good job for how they're presenting it, but the consumer needs to be re-educated. And again, what a difference to bring a premium back to reality for people and to maintain retention of an employee long-term. Some of the calls I got today were many employees who are facing their current health insurance are saying, I got to drop my family off the health plan because I can't take the contribution level. I just can't afford this insurance. I don't see any value when I have a $7,000, $8,000 deductible and the employer is budgeted to the worst dollars they can to maintain this coverage. So, ladies and gentlemen, through the Chambers of Commerce, through the work that this team is putting together, we have a victory. And all it needs to do is for you guys to be educated. You will see that everyone is protected. The companies behind the scenes have met their underwriting requirements, their fiduciary responsibilities, and we can make health insurance a benefit again, rather than only for 22% of the public with a struggle to barely pay your premium. So let's get into further examples and questions by everyone. But I think we're in the right track right now. And it took me 35 years to see the changes and bring it back. And I just to give you a little insight, I helped develop health savings accounts, and we were honored by President George Bush for the work that we did there. To me, this is the greatest gift I can give to the community, is giving back a solution to make insurance affordable again. Thank you for your time. Look forward to your questions.
You bet. And we do have questions. Thank you, Steve. Excellent questions as well. So we're inviting you to address our panel with specific questions or general questions for all 5 of our panelists who are here with us today. Here comes a question that's in the chat. And this comes from Alicia. Thank you for this great information. We're a small business in New Haven, less than 5 full-time employees, but currently growing and looking to offer benefits. Can the HRA be offered on its own or must be alongside a regular health plan that we must offer to our employees? If it cannot be offered on its own, what basic plan would you recommend? And I think this is a question, Ina, that probably you might want to field right out of the bat. Ina?
Actually, I can jump. I'll jump in and take it.
All right, Michael. Yeah, it is muted. Thank you.
Yeah, so typically an HRA is attached to a health plan. So in this case, the MEC plan is a health plan which your HRA is attached to, and then you design your what you want your reimbursements to be based around that. Now, there are certain types of HRAs that can stand alone. It's a different animal than what we're discussing today. So there's obviously solutions out there that we could work on for you. But in terms of this program, the HRA is an integral part and integrated with the MEC plan and the wellness plan together in order to provide a more comprehensive solution. And I think the costs are relatively affordable by comparison when you look at other major medical. But there are solutions that we could discuss with you if you need it.
That's great. So our next question here is coming from Karen. Does the MEC plan network have many doctors like other insurances? And I think this is what you were addressing, Tim.
Yeah, absolutely. The network we utilize is PHCS. It's actually a network of over 700,000 providers nationally. So getting access to providers, doctors, urgent care, lab, x-rays should not be a concern. We have a really robust network. And for the lab component, it's both Quest and LabCorp. So all of your national labs are in network. And the other thing that's about the network too is if you have a doctor that's not in, they'll proactively outreach the doctor. So you could actually nominate a provider. You'll get a reference number that you can check the status of the provider and bring him in network. We have a lot of success with that too. So we can, the network's robust, but it's always growing for you guys.
Excellent. Great. I have a question I'll bring back to you, Steve, and perhaps all of you in the panel can answer this. We've noticed at the Chamber of Commerce a lot of questions, and you've addressed them here today, but I want to dig and drill down a little deeper. We all know about the questions with respect to pharmacological issues and dispensing of prescription drugs. That's always a very detailed question, but we also have seen a rise in mental health cases, and I see some of your programs are addressing that. So Steve, putting this whole thing together with Unified Healthcare Program, you've had that as sort of a new pillar in terms of coverage. That mental health care coverage for employees is very special and very important.
Well, obviously, your question is well taken. And there are specialties, there's outpatient people, other types of medical related people that are available in different levels of coverage. But the question is, it is not overlooked and it can be utilized with proper guidance, including medication.
Yes.
And if I can just jump in there, embedded in the wellness program is an EAP system, so an employee assistance program. So, we know that anxiety, depression, mental health is on the forefront of everybody's mind in this country today. So there is a service for them through that wellness program.
Steve, I'd like to come back to you with respect to that in terms of wellness too, because we've also seen health initiatives in some companies. Even with our own chambers, we have a walk wellness challenges that are being out there. We know that there are gyms and also even discounts for some companies that are encouraging working out and eating healthy. So talk a little bit about how you've been able to develop a plan that kind of fits that, because as we know, absenteeism from our organizations can really be very much diminishing in terms of productivity and wellness within the company.
Absolutely. It goes back to that productivity. right? But in terms of our wellness program and helping people become the CEOs of their own body and become healthier over time, it's inclusive for everybody. So it's not, the wellness programs of the past where, go jog 5 miles every week or go on those walks. I know some health plans offer you a discount on their deductible of $100 or $200 for putting those programs in place, and they work great. But more and more people aren't able to do that type of activity, physical activities, going to the gym and stuff like that. So what we offer is more of a education, right? So we offer health assessments. So that's one of the first things that an employee would do when they participate in the wellness program is they would go ahead, log on, and they would take a health assessment. Now that health assessment is about 25 questions. It takes about 20 minutes to answer. And then what that will do is kind of like a stoplight, right? Red light, green light, yellow light. It'll show you areas where you're excelling, areas that should be a concern, and then areas that, whoa, let's talk right now about, what you're doing, your health, because there is an issue in terms of maybe heart or whatever the case may be. But each one is individual, right? So what will happen is when you get the results of that health assessment back, you can click on a button and it will put you in touch with a wellness coach or a nurse or a doctor, right? And you can kind of go through your findings, what your health assessment said, and really put you on the path of becoming healthier, right? So we talk about mental health. We have counseling that people can go ahead and talk to a medical counselor, whether that's the individual, that's the employee, or their spouse or their children. They can reach out and utilize this counseling service. They can also utilize the EAPs. So within the wellness program, you have health assessments, you have wellness coaching, you have health courses that you can take, health webinars, counseling, medical triage, the telemedicine, the biometrics, and all these things that are embedded. There's really something for everybody within this wellness program. All those activities count towards your compliance of 4 activities per year. So we're looking at about 2 hours worth of time throughout the course of the year to stay compliant for the wellness program in order to earn that benefit credit. Like I mentioned earlier, the national average is about $150 per employee per month. So they're seeing about $1,800 to $2,000 a year that they can utilize to purchase those insurance policies.
Great. A lot of good detailed information there, Steve. I want to, Steve, ask you, Steve Glick, as you put all of this together, and you and I have spoken about this before, we're now seeing, of course, medical community research and solutions to health issues. So we have improved hearing devices, audiology, for example. For many years, hearing aids were not covered on some programs. In terms of select eyewear and prescription eyewear, for example, or even the dental programs that we've talked about today, because now we're living in an era of implants, not just bridge work and false teeth. So now that we've had a different change in that, how are these programs covered?
The great thing is probably more than the traditional plan, because the beautiful thing, as long as they meet the requirements of the federal government as a product, all of these things are covered. And there are special programs like through our MEC plan, through HRA and other things that can be utilized to help purchase these things. The freedom of what we're trying to do will encourage better health, because people have more opportunities to take care of themselves in different levels of medical care. Right now, again, what happens when you have $6,000 out of your pocket that have to be contend with before you could get payment back from an insurance product? No longer do we need to worry about that. And that's why the past has been, we can't live in the past, yet people are living in the past. And that's why, as I said, only 22% of the people are getting some form of medical care. Others are going without. People are getting unhealthy and spending more money when they have serious problems. This is an evolution that has to be made. And my vision after 22 years of developing health coverage and 35 years in the industry, it's time for the Chambers of Commerce to take the lead in their communities to help the community grow and prosper and keep money in its right spot rather than going toward for-profit situations today.
Great. Well, we're going to wrap things up here with the closing comments from all of you. I'd like to go around our roundtable here today. There are a lot of questions, and yes, we've seen in our chat Q&A box here, we will provide you contact information. Steve will tell you how you can get in touch with Chamber Insurance Trust. We brought all of our guests here today, and how this is exciting, how we're putting everything together. I'm going to go in reverse order of our attendees here today. I'll start with you, Tim Ferrone. If you were to say in a 30-second, 45-second comments, the changes in healthcare and putting all this unified healthcare program together, the benefits for our employers and employees.
Yeah, absolutely. Well, thank you so much for attending. I think the most important thing, we're unbundling what, the overcost bundled product that's out there today. Major medical insurance is extraordinarily expensive, and I think what we're doing here at Unified is really let you unbundle that. And as we talked about, the things, the especially things that aren't covered, we give you discounts, we give you the ways to utilize these services at a fraction of the cost while having access to your daily care at a national basis with a really strong network at a quarter of the cost of what it'd be in a major plan. So I appreciate everyone's time and attention. Thanks for Steve for putting this together. And I look forward to working with you guys all. Thank you.
Great. Tim Ferrone, thank you so much. Options Plus. And also Steve Riggs, closing comments from you, National Health and Wellness, and your presentation today.
Yeah, so I really want to just thank everybody, number one. But number two, our goal really is to help businesses save money, offer a better, insurance policy to their employees, and for the employees to help financially protect themselves. Little quick example, in the past week and a half, we've written up 5 businesses that have a total of about 151 employees. I just want to talk some numbers because realistically, the business owners that are watching this and the insurance agents that are watching this, these are numbers that you can really talk about and really sink in. So about 151 employees on wellness within 5 companies the past week and a half. We saved those companies a total of over $75,000 annually. And we put in over $330,000 worth of benefits without adding any expense to the business or to the employee. Now, when you talk about impacts, I don't know if there's a bigger impact than that. And that's really what the unified plan is all about. So I appreciate Steve Glick putting this together. I appreciate your time today so we can spread the word on how we can help the businesses and their employees. So thank you.
Thank you, Steve. And again, also from our health reimbursement arrangement, our HRA that we learned about from TASC, closing comments, Michael and Inna as well. I'll start with you, Michael.
Sure. So, so just think about the HRA as part of this, the part of this program that is the tailorable side of things from an employer's perspective. We're giving a promise to pay so that you can mitigate healthcare costs that fall outside of the wellness and the MEC plan. The employer gets to choose how big that promise to pay is and determines what levers are available within that HRA and what the plan will reimburse, whether it be medical, dental, vision, copays, and so on and so forth. So that's the part that's tailorable and allows you to enhance as much as you choose the other 2 plans to provide as comprehensive a plan as you want to choose.
Great. Inna.
You're muted, Inna.
Can everybody hear me?
Yes, we can.
Okay, perfect. Yeah, so I want to kind of piggyback a little bit off of what Michael just said in regards to HRAs. And I know there was a couple questions from some of the attendees as far as how they work with a health plan. I want everybody to feel free, to reach out to this group, everyone here, the chambers. Please reach out to TASC, taskonline.com. We're happy to help answer any questions. I'm sure my contact information will be shared as well. Feel free to reach out, ask questions. We're always happy to help. We're always happy to strategize. And and help you, retain and keep your employees. So again, thank you everyone for having us. Thank you for having me. Thank you for the opportunity to let me present. Thank you. Have a great day.
Great, and thank you, Inna Kuracek, Michael Leffler from Task. Also want to thank you, Steve Riggs from National Health and Wellness, Tim Barone from Options Plus. Thank you all. And Steve Glick, you have the final word today. Just give us the marching
Yes.
orders, how we can get to Chamber Insurance Trust and learn more about these programs and Unified Healthcare Program.
Yes, my final statement is we have to go back and where I started with Chambers of Commerce more than 35 years ago. We have to have a resource for you as business people to feel comfortable. And you need a place to communicate. What better place than your Chamber of Commerce? We did it at earlier stages. Many more people were members of Chambers of Commerce in their community, and we encourage that. The other side of it is we are trying to communicate with the chambers, but we also have our own radio announcement across the state to share ideas as well. But this is all in collaboration with what we're trying to do. But please call us at 203-795-9756 or to go on our website, which is citrust.com, or call me direct at 203-795-9756. But those that are here and are considering membership, especially in the Greater New Haven Chamber, really, this is another reason to join. We will give you more pleasure than ever before. A unified relationship in a community makes a strong community. Be well, everyone.
Great. Steve,
Look forward
thank you
to
so
it.
much, Chamber Insurance Trust, and for all you do too. Want to thank you all. And of course, we have this up on our YouTube page, so you can come back and you can get more information from the Chamber of Commerce, Greater New Haven Chamber of Commerce, the Quinnipiac Chamber of Commerce, and our Small Business Council here with the Chamber. You can learn more about our events that are upcoming throughout the year. We'd love to meet with you and help solve your business problems. That's at gnhcc.com or Quincham, as in Quinnipiac Chamber, QUINNCHAM.com. Thanks to all of our panelists once again. I'm Ray Andrusen, Executive Director of the Quinnipiac Chamber of Commerce. Affiliate chamber is the Greater New Haven Chamber of Commerce. Thank you very much for being with us.